Good day, class. So this will be our part 2, Causal Inference. So we are now done with the ethics part of our module, yun yung previous one, public health ethics. Now, let's talk about statistical association naman dito regarding sa public health research. Okay? Remember, one of the importance of epidemiology is to identify the risk factors that could make a person susceptible on a particular condition. Kasi nga, tatandaan nyo, in epidemiology, we believe that diseases do not occur randomly. Hindi lang yan basta-basta. Nasumpa siya or that particular person is cursed. Gano'n, no? Ginayuma siya or etc. Na-engkanto siya. Hindi tayo ganun. Kailangan meron tayong scientific evidence, no? But evidence-based tayo. So when you say statistical association, it is the identifiable relationship between exposure and the disease. The degree to which the frequency of disease in persons with the specific exposure is either higher, or yung natawag natin positive, or lower, which is negative, than the frequency of disease among those without exposure. So yung mga frequency, measures of disease frequency, yun yung mga diniscuss natin on the previous topics, no? So on that note, pwede nating sa statistical association, we could identify, no, if yung mga exposure and yung outcome is causal or non-causal. Okay? So, ayan. Tingnan nyo, may nag-usap na. Sabi niya, everyone knows correlation is not causation. Sure, that's why we have causal inference. So, in epidemiology, not all correlation are significant. Meaning, presence ng correlation is not causation. That is why there is causal inference. Hindi porket si A ay associated kay B, hindi na ibig sabihin causation. Si A ang nagkakos ng B. Hindi, no? Hindi ibig sabihin na si A is related kay B. Ibig sabihin ba nun, si A ba ang nagkakos kay B? Hindi. Kailangan, meron tayong tinatawag na causal inference. Okay? So, causal inference. Causal inference is the term used for the process of determining whether observed association are likely to be causal. It does not simply decide whether an effect is present or not, but it focuses on the measurement of an effect. Okay? So it determines the presence of validity of a statistical association before assessing an association. Other explanations such as chance, bias, and confounding are excluded. Ulitin ko, bago mo i-assess yung tinatawag na association, no, between your exposure and outcome, kailangan dumaan muna siya sa mga explanations such as yung chance, no, bias, at saka confounding. Okay? Again, causal inference determines if observed association is causal, so it considered totally of evidence taken from a number of sources. Okay? Now, I'm sure you're familiar na with this pie, no? So this is the causal pie. The nature of causation is multifactorial, no? Maraming pwedeng reason, no? Which is yung each slice, yung component pies natin, or yung component cause. Yan yung factors ng isang sufficient cause, no, or ng outcome mo. In our previous discussions, nung ating topic, ano man topic to, 1 or 2, anyways, yun yung sa initial topics natin, if you still remember, you were introduced to the epidemiological triad of disease, di ba? Yung tatlo, host, agent, environment. It consists ng triad na yun. So, this triad is applicable for only communicable diseases. Doon lang siya applicable. So, hindi siya applicable sa mga non-communicable diseases. CVD, cancer, or mga lifestyle diseases. So, kaya mas maganda, we have what we call the causal pie. Okay? So, yan yung sufficient cause, necessary cause, tsaka yung component cause. So, if you want to review the causal pie, you just ask your instructor. No? Hindi na ako yung instructor nyo sa sections A, B, G, F. No? So, tanungin nyo na lang si Sir MJ. Thank you. Now, how to determine if observed association is causal. Ayan, dito tayo sa main focus natin. Paano ba natin ma-determine if your observed association is causal? Now, we have what we call the criteria. Yung Bradford-Hill's criteria or guidelines. And in doing so, you have to take note that no single study is sufficient for causal inference. Okay? Tapos, causal inference is not a simple process. Okay? So, what's the main concept of causal inference? Now, let's talk about the sources of error. Ano ba yung mga sources of error muna? Okay? The main goal of epidemiologic investigation to provide accurate measures of disease outcomes. However, yung mga measurements na to are not free from error. Thus, much attention is given in order to minimize these errors of not totally eradicated. In epidemiology, there are two types of error. You have the random and systematic error. So basically, similar lang sa mga chemistry, sa mga lab management, and etc. Yung systematic at saka yung random error. So, random errors, pag in the sense of research, no, these are errors that cannot be fully eliminated. Okay? They arise when a value of a sample measurement diverges, no? Lumuluwas, humihiwalay yung particular value na yun. This is due to chance, no? Take note of that. Bakit nagda-divulge yung or nagda-diverge yung value, no? So that is because of chance. And because of that, they cause inaccurate measures of association. There are three major sources of random error. Meron tayong individual biological variation, sampling error, as well as measurement error. So, sometimes in study, the small sample size do not reflect all of the population's variables. Okay? That's why there is a sampling error. No? Hindi na kaya nga dun sa, di ba, sabi dun sa pinaka-initial topic natin, kailangan your participant represents the whole group. Kapag hindi mo napili ng maayos, if you did not choose your participants well, so meron kang tinatawag na sampling error. In measurement error, there will always be individual variation. Okay? Remember that no perfect measurement is perfectly accurate. Okay? Even in clinical labs, sometimes you use the same machine and the same specimen, but there can still be variation in the result. So, paano mo ma-resolve to kung nagkakaroon tayo ng what you call na variation? So, you must have strict protocols and make measurements as precise as possible. Okay? You will be measuring analytes in your study. Make sure that the lab machines or the lab itself where you will perform in the tests have quality control, the machines are well calibrated, ganon, no? So, kailangan maayos or in standard of standard yung mga gagamitin ninyo. Okay? So, next type of errors are the systematic errors or yung tinatawag na bias. Okay? So it occurs when results differ in a systematic manner from the true values. Okay? And accuracy is not affected by the sample size or pwede din namang high accuracy or small systematic error. So in here, accuracy is not affected by the sample size and yung study mo is considered with high accuracy. So when there is only a small systematic error, sobrang accurate ng study mo and napakaliit lang ng systematic error. Aside from principal biases mentioned, there are other possible sources of systematic errors such as yung selection bias, no, measurement or classification bias, or yung natawag din natin na confounding, no. Ito yung pinaka problem ko sa mga undergrad research papers, no? Sa mga papers nyo rin. Kapag ako kasi noon, pag nagpa-panel ako with the research papers by the MedTech, tapos yung mga research papers nila is regarding knowledge, attitude, and practices of ganyan-ganyan. Tapos, ang participants nila usually mga medical technology students, no? So doon pa lang makikita nyo na merong selection bias, no? Even though the study itself is about, sabihin na natin tungkol siya kunwari sa knowledge, attitude, and practices nila towards flu, no, influenza. Ang mga medical technology students, they are already informed regarding, or they are well versed or knowledgeable sila doon sa magiging study. So basically, that is already selection bias. Butas na yung research na pag gano'n. So kailangan iwasan niyo yung gano'n. Notice that these principal biases are what I have mentioned earlier, no? Part ng causal inference that you have excluded or eradicate before performing causal inference. Okay, so yan dapat matanggal yun. Selection bias, measurement or classification bias, and confounding. Actually, napakaraming biases. So these are the principal ones. So selection bias, na systematic error, it occurs when there is a systematic difference between the characteristics of the people selected for a study and the characteristics of those who are not. What is meant by characteristics may include but not limited to age, yung smoking, yung race, and etc. For example, people who respond to the subjects in a study about the effects of smoking and the people included in the study or volunteered for the study have different smoking habit to those who were not included. Pwedeng the ones na not included in the study have a heavier smoking habit, no? So yun yung so ano bang effect nun? Anong expect nyong effect nun na yung mga sinali mo lang sa study is yung mga hindi masyadong nagsisigarilyo or wala talagang smoking habit at all. So, bias na yun. Therefore, it creates a bias or estimate of the association between exposure and outcome. Okay. Okay. Another example is you want to address or you want to understand yung if aware ba yung mga college students regarding vaping, no? Or yung smoking or e-cigarettes. So, regarding this, tas namili ka ng mga participants mo. So, dahil college students, kung sino-sino na lang, tapos hindi mo man na-assess or nalagay sa criteria na or hindi mo na-consider na ang nakuha mo palang mga participants are all against vaping or e-cigarettes. Therefore, bias na yung research paper mo. Malamang sa malamang, you have already a positive outcome, no, dun sa study mo. Kasi bias na yun. Okay? So, usual source of selection bias are the following. First, yung when the participants select themselves, sila mismo namili. No? For example, these participants are unwell or they are afraid that they have been exposed, thus, they volunteer to the study. No? Number two, when the disease or the risk factor being studied makes people unavailable for the study. For example, you want to study the exposure of factory workers to the harmful chemical formaldehyde. The tendency is most factory workers who suffer most eye irritation leaves their job as they start to develop those symptoms. So, yung mga remaining workers are not exposed, enough if they will be your participants. Association outcome may be misleading. So, pansin niyo yan, no? To simplify, yung mga factory workers daw na exposed sa harmful chemical na formalin. Okay? We all know na high exposure of formalin, it may develop yung mga eye irritation. And because of that, nag-resign sila. And yung study mo is a prevalence study. So, ibig sabihin, kukuha ka lang ng snapshot. Diba? Cross-sectional. So, snapshot lang siya. And nung snapshot na kinuha mo is nung mga panahon na nag-resign na yung mga nag-develop ng eye irritation. Therefore, yung mga naiwan na lang yung mga healthy individuals. So, basically, yung magiging outcome mo is misleading. Okay? Next is information bias. Information bias can occur when the incorrect information collected from the study participants regarding exposure or disease or both. Okay? Therefore, from the same study regarding exposure or disease outcome is also incorrect. So, wrong information yung na-input mo, therefore, mali din ang magiging outcome na makukuha mo. Diba? So, napakadali. For example, in case control, some subjects who actually have the disease were misclassified as controls and some without the disease were classified as cases. Nagkabaliktad, diba? Yung control mo, yung control group mo, wherein dapat sila yung unexposed, no? Sila yung naging exposed, tapos yung mga cases mo, they were the unexposed talaga. So, therefore, nagkaroon ng misclassification or switching, kumbaga. So, given the inaccuracies, subjects were misclassified. Thus, we often refer to this as misclassification bias as well. Misclassification. So, this type of bias arises from the limited sensitivity and specificity of the diagnostic tests. So, inadequacy of information derived from medical records. Pwedeng the diagnostic test used in establishing those who have the disease or not have limited sensitivity or specificity. Ibig sabihin, hindi niya na-detect ng maayos or pwedeng na the information gathered from the medical or other records are inadequate. Okay? So, misclassification bias may occur in two forms, pwedeng differential or non-differential. Now, the two types of misclassification bias. The differential misclassification muna tayo. So, since different yung rates, this can lead to differential misclassification. Occurs when rates of occur differing the groups being compared. So, it can lead to either an apparent association even if one does not really exist, or to an apparent lack of association when one does in fact really exists. Pag naman non-differential misclassification, kanina sa different, sabi doon, different yung rate of error. So, dito, non-different yung rate of error. So, it occurs when errors are in a similar proportions in the groups being compared. So, this type of bias, it is less likely to detect an association even if one really exists. Okay? So the bias usually towards the null or yung null hypothesis or yung no association. Okay, ayan, no? So, meron tayong visual aids dito. So, misclassification, non-differential misclassification of exposure. So, this would result to a null or no association. Kasi, there are same number of test subjects in the two groups. Yung maling na classify. So, yung 1, 2, and 3 for the exposed, deceased, and the 3 also for the exposed deceased. No? Ayan, tatlo. So, basically, pag sinolve mo yan, ang makuha mo, there is no association between them. So, basically, nagkaroon ka ng non-differential misclassification. So, with this type of bias, it is less likely to detect an association even if one really exists. Okay? Dito naman, with this type of bias, it is less likely to detect an association even if one really exists again, no? So, differential misclassification, magkakaibang number ng test subjects ang namali ng pagka-classify. Okay? So, nagkaroon dito, no? Meron siya dyan, meron siya dito, meron dyan, meron dito, no? Balibaliktad, nagkakaroon ng misclassification. Okay? So, it's really impossible to detect an association. Okay. Next is the concept of confounding. So, what do we mean by confounding? For example, in a study, we're trying to assess if the factor A is caused by the disease B. No, factor A, disease B. Okay, but there is another factor, which is the factor X. Okay. This factor X is a known risk for the disease B. Known risk siya ng disease B. And is associated by factor A but is not a result of factor A. Therefore, factor X is considered a confounding factor. Okay? So, for example, characteristics under a study, factor X, factor B. Meron ba tayong example dito? Ito pala, may example dito. Ayan. Ayan. To further understand what confounding is, please take a look at the illustration. So, dito, it denotes that the smoking can cause heart disease. Nasaan yung heart disease? Ayun. Ayan. So, ito yung magiging disease B mo. Factor A. Exposure daw sa coffee drinking would lead to ito yung outcome mo. This is B. Okay? So, yun, no? So, factor A, this is B. The arrow right here naman shows the relationship between smoking and coffee drinking. Ayan. Smoking and coffee drinking. Ayan. Tiyun. Associated daw sila with each other. Okay? That is that the coffee drinkers are more likely to smoke than non-coffee drinkers daw. Okay? So, the tobacco use can cause heart disease. Alam natin yan. Yes, that is true. Pero, dun sa study mo, gusto mong malaman, coffee drinking, heart disease. Diba? Again, if we go back dun sa ating causal bias, tatandaan nyo, bago ka magkaroon ng sufficient cause, there are multi-factors or there are different component causes. So, confounded association ng factor A kay disease B because it does not mean na nagdi-drink ka ng coffee agad ka nang merong heart disease. No, kailangan meron ka pang tinatawag na confounding, which is tobacco use. Meron pang another factor involved before mag-develop ng heart disease. Kailangan some of your participants might be coffee drinkers And they also use tobacco before they develop or they are at risk for heart diseases. Okay? Nakakalito pa rin ba? Meron pa tayo. Sige, bigyan ko pa yung pinakamadaling example. The most common example is ito. Yung factor A mo is water drinkers. Ay, ba't natanggal? Ano nangyari? Ayan. Water drinkers. Water drinking. Yan yung A mo. Sabi ng study mo, pag lahat daw ng umiinom ng water ay mayroong cancer. Is that true? Yes, that's true. Lahat ng may cancer umiinom ng water. Okay? So, that is a positive association. However, there is a fact that we know na lahat ng mga cancer patients, it is hereditary. No? Merong mga certain cancers that are hereditary. So, yun yung magiging confounding mo or yung factor X. Is it because of a particular gene? Kaya bakit kaya sila merong cancer? Diba? And all of this na merong mga gene na nagkakos ng cancer or hereditary of cancer, they are also all water drinkers. Diba? So basically, meron tayong tinatawag na confounding variable. Hindi porket lahat ng cancer patients umiinom ng tubig, hindi na ibig sabihin nun na ang pag-inom ng tubig is the cause of cancer. There is always another factor involved there, which is your confounding factor or confounding variable, which is in this case yung pagkakaroon nila ng particular gene na na-inherit nila, no, na nagkakos ng cancer. Okay, so that is the confounding variable. Okay, next, confounding, mixing of the effects of a third variable that is associated with the factor or it's considered as a risk factor of the disease. So this is controlled by the restriction, matching, randomization, stratified analysis, tsaka multivariate analysis. Okay, so next we have the validity. Okay, so now with all these sources of error, how can you determine the validity of a study? Paano mo malalaman na valid pala ang iyong study, no? If there are existing errors. Okay? Tatandaan nyo, biases and mga errors, kahit na ilang beses mong iwasan yan, it's really hard, no? Accidentally, maaari mo pa rin silang magawa. Okay? So, ito yung magiging sagot nyo dapat nun kapag tinanong kayo ng panelists, especially ako, tinanong ko kayo regarding the biases of your study. And the answer there is validity. A study is considered valid if its result correspond to the truth, meaning there should be no systematic and random error should be minimized as much as possible. So we have two types of validity. Internal validity, so ibig sabihin it is within the study itself. So in this study, the validity within the study, the degree to which the result of an observation are correct for the particular group of people being studied. So in this study, their systematic errors may arise from different factors. No? For example, dito, measurement of hemoglobin in diagnosing anemia. Maaring yung factors na makuha mo yung systematic errors ay daling sa different laboratories used in the different methods, no, in hemoglobin determination. Diba? There are different methods tayo dyan. But the study can still be internally valid as long as they follow the criteria or the set cutoff values that would classify a patient as anemic or not. So, maaring, ano ba nung naaral niya na O sige, kunwari, sa Anachem, di ba, meron tayong titration, di ba? So, there are different methods on measuring acid and base relationship. Okay? Pero, if there are standardized na mga results, no, kukuha kayo ng mga research papers o kaya mga guidelines, chemical guidelines ng mga specific pH ng mga chemicals, even though different methods yung gagamitin mo, mami-minimize mo yung systematic errors. Diba? And that's what we call internal validity. Next is external validity naman. It refers to the generalizability. Okay? It's the extent at which the study can be applied to the people outside the study. So for example, again, you assess the evidence that the effect of lowering blood cholesterol in men is also relevant in women. So, this requires external validity first. Tatandaan nyo yan. Kasi nga, for a study to be externally valid, it must be internally valid as well. So, kailangan bumalik ka muna sa internal validity. You assess yung standardized cut-off values ng cholesterol in men tsaka sa women. Ano ba yung mga reference values na tinatawag na? Ano yung normal values? For example, sa men, dapat ito lang yung range ng cholesterol nila. Pag masyadong mataas, that is considered is high cholesterol. Pag masyadong mababa dun sa reference value, that is low cholesterol, diba? So, dapat meron kang reference materials, diba? Or standardized normal range. Okay? So, external valid. Remember, not all internally valid studies are externally valid. So, kailangan yung validity, it should start within. Kailangan internally, bago ka lumabas doon sa external validity mo. Okay? So, dito tayo sa Bradford-Hill's guidelines to determine the nature of association. So, these are set of considerations for causation that an epidemiologist should test to reach a conclusion about a cause of disease. Okay? So, meron tayong 7. Isa-isayin natin yung mga yun. Number 1 is temporal relationship. It answers the questions. The question, does the cause precede the effect? Okay? For an association be considered as a causation, the cause must always precede the effect. The cause has to occur first. Sabi doon, diba? So, this refers to the time relationship between the suspected cause and the effect outcome. A cause always precedes an effect. So, not just smoking. So, for example dito, no? Not just smoking. Air pollution can also be to blame for lung cancer, diba? So, you need to consider this as well. Okay? Next, biologic plausibility. If the cause and effect relationship is consistent with the existing body of knowledge, therefore, the proposed causation is likely plausible or probable. So, proposed causal mechanism should be biologically plausible. The assertion of cause and effect relationship is more likely to be correct if it is consistent with the present knowledge in medicine, if the mechanism of relationship can be explained in the light of what are known. So, kailangan yung most likely results mo is consistent with the current knowledge natin with the science. No? Kailangan hindi ka humihiwalay doon sa kung ano man ang binigay ng science. If hihiwalay ka man, make sure na it is really correct, no? Na valid yung resulta mo. Okay? So, next is the consistency of findings. So, consistency is demonstrated by several studies giving the same result. Ayan. So, importante yan. Yan din yung lilitaw sa research paper mo. Yung pag nagsusulat ka na ng conclusion, sabihin mo na kunwari yung findings mo is madalas magkasakit ang mga medical technology students before the major exam, no? So, yun yung naging result mo. Madalas nagkakasakit ang mga medical technology students before major exams. The main factor is for them to prepare more time other than their colleagues. Tapos, this is similar to the results of magsasite ka nun ng ibang mga research papers, no? This is consistent with the research of ganito, tapos ganito din yung nakuha ang result ni ganyan, tapos ganun, no? So, consistency in findings yung tawag natin to. So if the studies were performed using different populations in different circumstances, so using these different study designs and still they obtain the same results or outcomes, then that's good. That's a good sign that the studies are not simply making the same errors dun sa study mo. Okay? So, find consistent findings across different population, different circumstances, tsaka different study designs. Okay? Next is the strength of association. In most cases, a strong association between the possible exposure and outcome or yung cause and effect as measured of the size of the risk ratio. Yan, tingnan mo na yan, yung RR or yung relative risk is more likely to be causal. So, strong associations are less likely to be caused by chance, by bias, or confounding. Okay? The greater the value of RR and OR, the greater the probability that the association is causal. As long as walang misclassification, diba? Walang magkakabali-baligtad, walang differential, etc. Pag walang nagkabali-baligtad na data, kinompute mo ng tama yung risk ratio, relative risk mo, yung odds ratio mo, no? This is considered as causal. No? Next is the dose-response relationship. So, this one naman usually for pharmacy. Changes in the level of cause associated with the changes in the frequency in the disease. If an exposure causes the disease, it is logical to expect that the greater the exposure, the greater is the probability of disease. Coherence is the criteria that suggests that the cause and effect interpretation of data should not seriously conflict with the generally known facts of the natural history and biology of disease. Okay, that is coherence. For example, you want to detect the amount of platelets in the blood. Pero dun sa study mo, gumamit ka ng serum instead of a whole blood. So, in the known facts, if the natural history of the biology of the disease, you will not get platelets on your serum samples. Pero in your study, you obtained platelets from that point, no? So, dun pa lang, incoherent na yung study mo. Okay, kumbaga, you are lying na, no? Unless you have proof, you have a validated proof or evidence na nakuha mo talaga yon, which is really impossible. Okay? So, that is coherence. Specificity of the association, this means the exposure leads to a single characteristic effect or affects people with a specific susceptibility. Meron siyang si factor A mo, isa lang yung magiging specific disease effect niya or outcome niya. Okay, so that's it. So thank you for listening to the topic 10. Two parts po ito. Part 1, yung ating public health ethics. And then part 2 is the causal inference. Again, if you have any questions, even though I'm already gone in the AUF, hindi ko alam kung gumagana pa tong email ko niyan, kung mag-email pa kayo. Pero sige, kung mag-email kayo, yan, ito yung aking email at auf.edu.ph. Okay, so if you have any emails, if you have any questions regarding the topic, don't hesitate, no? Just email me kung gumagana pa yung email ko. Okay? Because this will be my last topic for my entire academic profession here in the Philippines. No? So, thank you so much, and it is my privilege and pleasure to serve you as my last students. No? So, thank you, second years, and good luck and God bless in your future. Hope to be your colleague in ilan na ba? In 2 years, 3 years. No? Anyways, hopefully RMT kayong lahat, and in the near future, alam ko some of you will take also the medicine course, no? Magiging physician, so hopefully magtagumpay kayo. Okay, so that's it. Thank you and God bless.